factors which are influencing the gastrointestinal absorption of the drug. There are the pharmaceutical factors and there are patient related factors. So the GI absorption of the drug will depend upon how I produce, what is the physicochemical parameters related to the drug and how is the dosage form prepared, and other one is dependent on the individual. So with pharmaceutical factors, we have physicochemical properties of drug substance, which includes the drug solubility and dissolution rate, the particle size, and as we know, smaller the particle size, bigger the surface area, larger the surface area, more better is dissolution or formation of solution, more better is the solution formation, faster will be the absorption. Complete absorption, 100% bioavailability. Then there is polymorphism and amorphism. Then there are pseudo polymorphisms forming with respect to hydrates and solvates. Then there is if we are using some prodrug technology or a salt form of the drug, whether the drug is lipophilic in nature, what is the pK of the drug, which is related to the pH partition coefficient or pH partition hypothesis related for drug permeability and absorption, and then stereochemical nature of the drug. With related to dosage form characteristics, there are various factors which are for the quality test also, that is disintegration time, then the dissolution time, various manufacturing variables like if I'm doing mixing, if I'm increasing the temperature, if the powder is undergoing compression. So there are various factors in manufacturing variables. Then the pharmaceutical ingredients depending on the dosage form. If I'm looking for a tablet, then the excipients like binders, glidants, lubricants, bulking agents are considered. Then which is the best suited dosage form for improving the dissolution and the absorption of the drug. Then the shelf life and the storage condition of the prepared dosage form. Then related to the patient, individual physiology or and pathology of the organ or the patient, we can say, related to and the organs, how healthy the patient is. So we see the age, which plays a very important role with respect to the villi and the microvilli which are present in the small intestine, how cilia, what we say, the movement of villi in the stomach, how well they are, so that the drug can move from one compartment to the other compartment. So that is related to the age. Then the gastric emptying time is also checked. Then the transit time, the drug, at what time the drug leaves from the intestine, moving towards the liver or to the bloodstream. Then the pH, during disease conditions, basically there is some abnormality with respect to the movement of the drug from one place to the other, or there are chances that the drug remains entrapped in the given organ because the organ is not functioning well, or if the pH is not constant. Okay, the pH has changed in the body because of maybe the bacterial growth or because of the enzymes. Okay, then how is the blood flow in the GI tract? Then what are we consuming when we are taking these drugs also? Are the drugs, one drug is taken with the other drug, are they compatible with each other? What fluid intake, how much fluid intake, are you taking a lot of sugars? Then food diet is also seen. Other normal contents like the healthy bacteria which should be there, or the enzymes should be present in GI, are there, or the person, because of his daily stress and diet, whether the enzymes and bacteria are not present. Then there are various enzymes related, that each and every organ has its own enzyme. So are they working well? Are they functioning well? Is need to be checked with respect to individual patient. So in this pharmaceutical factors, we basically are going to see the physicochemical properties of the drug, the type of the formulation, which I've already shared with you all, which is going to be a part of your assignment, and the nature of excipients. In this physicochemical parameters, we'll see the drug solubility and the dissolution rate. Now, as shown in this picture also, we can see there is a solid dosage form, which you can take as an intact tablet. This tablet should undergo disintegration and deaggregation so that it forms particles. These particles are ready to get wet by the biological fluids or the GI contents or GI fluids. And by wetting, it will undergo dissolution. Okay. And then the drug will go in the solution form. And once it is in the solution form, it is ready for absorption. Okay. Now, what happens is, if the drug is water soluble, it will undergo dissolution very easily. It will form a solution very fast. It is ready at the absorption site also. But the problem with this will be the permeation, which is the first layer, which is the lipid layer. From here, it cannot permeate inside. So here, the permeation will depend upon maybe the molecular size, the molecular weight, how the drug will partition. The partition coefficient will play an important role. So after that, the drug will be available in the body. So the main factor on which the activity is dependent is permeation. And so this permeation is a slowest step for a water soluble drug. And so permeation is termed as rate determining step for water soluble drugs. Similarly, if the drug is not water soluble, the rate determining step or the drug to be available now in the absorption site would be dissolving this drug, because the GI contents will again contain water, which would be incapable of dissolving the lipophilic drug. And so the dissolution will be the very slowest step for the lipophilic drug. So depending on modifying the dosage form, I will improvise the solubility parameter of the lipophilic drug. So, but dissolution will be the slowest step, which will determine when the drug will come at the absorption site. And so dissolution for a lipophilic drug is a rate determining step. If a drug is hydrophilic, having a high aqueous solubility, chromoline, sodium or neomycin, the dissolution is going to be fast, and rate determining step for absorption is going to be the permeation through the biological membranes. Okay. This is an example for it. Then here basically there is a dose given. With respect to the dose, what would be the solubility parameter for the drugs with respect to, if it is a 0.1 milligram per kg body weight of a dose, the high permeability, the medium and the low permeability values are discussed with respect to the therapeutic doses. Then, for example, if the two drugs which has the same absorption rate constant, okay, if the Ka value or what we say absorption rate constant is same value for two drugs, the one with the greater solubility will have a greater maximum absorbable dose. So here there is a concept of maximum absorbable dose, so that you can correlate the drug absorption with the help of solubility. And this maximum absorbable dose, which is MAD, it is directly proportional to the rate constant, absorption rate constant. How much of the drug is soluble in the GI fluid, what is the volume of GI fluid, and how much time the drug will reside in this GI tract. So that can be stomach also, that can be small intestine also. So it gives you basically the limiting factor or the limiting effect of the drug absorption. Either the drug is well soluble in the GI tract, and what is the absorption rate constant for a given drug in the solution. Okay. So here basically if the two drugs, if the Ka value is same, okay, the drug which has a maximum solubility will have a larger value of the absorbable dose. Then based on the data of the solubility and the permeability of the given drug, there is a biopharmaceutical classification system prepared. Okay, it is actually a written document. There is a review article also available which has a complete list of this biopharmaceutical classification system with respect to the drugs. So there is a list of drugs name and under what category it comes is being given. So if you can find out through a Google search this article, so you can have it for your record. So here basically the drugs are being categorized with respect to the solubility in the GI fluid and permeability to the GI membrane. Okay, so there are 4 classes being categorized. Class 1 will contain drugs which has a very good solubility and very good permeability. So they are well absorbed, they are well permeated through the membrane, and example is diltiazem. Then class 2 drugs, in which the drugs which has a lower solubility and high permeability. So the absorption pattern can be variable, but the rate limiting factor because of the solubility is dissolution. Nifedipine is one of the example. Then there is class 3, which has a high solubility and low permeability. Again, the absorption pattern can vary because it has to it is dependent on the permeation of the drug through the GI membrane. Insulin is one of the example. And class 4 drugs, which has a very low solubility and a very low permeability. So actually, if you see, the absorption is going to be very low. So the bioavailability is going to be very, very low. So the rate limiting step depends upon the drug. Okay, if I work with the dosage form with increasing the solubility, permeability can be the rate limiting step. Taxol is one of the examples. As per the research which is going on right now, we as a researcher, we work with class 2 drugs because permeation is good through the membrane. We have to only work on the solubility. So by modifying the dosage form or by alternating the dosage form to get the best fit or effective dosage form, we can get a very good formulation which will show us the good bioavailability. Am I clear?
Yes, ma'am.
So
Yes,
working
ma'am.
on permeation through the membrane is actually very difficult. So आपको penetration enhancer, there are ways we can add to the dosage form like permeation enhancers or absorption enhancers, so that temporarily you can change the physiology of the cellular membrane. But if you want to take a drug for a longer period of time, तो वो membrane खराब भी हो सकती है. So rather than working on the permeability parameter, we as a researcher work on the solubility parameter because we have a lot of flexibility on producing various dosage form, finding the best fit of dosage form, which will show us the maximum absorption and bioavailability.